Welcome to today's Lunch and Learn session. Today we're going to cover how to manage your overdue reports. My name's Brooke. I'm from the immunisation team at Central and Eastern Sydney Primary Health Network. We also have Kira with us today and Mimi with us today too from the team. So all of us can help you with any of the things that crop up today. So feel free to call us or email us if you need. Without further ado, let's jump in. Central and Eastern Sydney, we'd like to acknowledge the Aboriginal Torres Strait Islander peoples of this nation. We acknowledge the traditional custodians of sovereign people of the land across which we work. We recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. A few little housekeeping things. So we're using the Q&A box today, not the chat. So if you have a question, feel free to pop it in there for us. And at the end of the session, we'll go through some of the questions if we haven't covered them already. If you want, you can do it anonymously. No need to, but you can if you'd like to. But just remember, chat button is not on. You'll also have all been muted, so we can't answer questions live, sorry. And the session's being recorded. And like all the webinars, there's an online evaluation form that will pop up at the end. Firstly, we just wanted to cover a few upcoming events because there's lots of things that CESPHN's offering. We've got a few that are on there next week. I won't go through them all, but next week we've got the cancer survivorship. That's in person at the Tradies Gaimea. And next Thursday, we've also got the evidence-based management of lower limb osteoarthritis, very specific. And there's a few other ones there as well. You can always jump on our events page to see and register for all the events that we have coming up. Importantly, there's also some CPR workshops and there's one next Monday, so don't miss out on that if you need to cover off your CPR training. We also have some cultural awareness training. This one's relevant if you are doing an Indigenous PIP. So 2 of your members of your practice need to complete this training, so make sure you get in there. There's lots of allocated hours there of CPD points of all different categories, so that's a good one. Now, our presentation for today is about immunisation overdue reports. Now, many of the practices are receiving these reports from us now. We've had a big project that we've expanded over the last 2 years, and we're really proud to say that we can offer it to a lot of practices now. We would potentially offer it to every single practice if you want it. What we wanted to show you was some of the immunisation coverage rates for this project, so you can see where your efforts are going and what the rewards are. Now, this is our coverage rates on a quarterly basis, all the way up to Q1 of 2023. Unfortunately, Q2 results are due out this Thursday, so I didn't have them in time for the presentation, but fingers crossed, the numbers are going up. Now, this is our national target, 95%. We all know that. Now, this is when we started our project, the red line. So maybe late 2020, we started looking at a small pocket of the eastern suburbs. The eastern suburbs coverage rates were quite low. They had been for a while and they were just consistently low. So we targeted them to pilot our project. Back then, and then COVID hit. So COVID covers all of that time there, that nice little virus. And as we know, COVID impacted coverage rates, but it didn't do it straight away. At first, they thought it was going to be horrific, but it wasn't. So for the first year or so, the results weren't too bad, but they have steadily declined across the whole nation since then. We're quite lucky. For some reason, CESPHN has not declined at the same rate as the New South Wales rates, but they have declined, and we can see that in the figures there. Back at the beginning, we were doing maybe around the end of 2020, we were doing about 50 reports. So that's 50 practices were receiving reports. By the start of this year, about 110 practices. So we've improved our processes and made it a bit more streamlined. But the best thing that's happened is we have exploded exponentially and we are up to 310 practices receiving a report in August. That is a 181% increase. So we're very happy with that, and we're hoping that you guys are happy to receive these as well. And by all the inquiries that we're getting coming in, you are looking at them, which is fabulous. Our rates, let's have a closer look at those. Again, these are end of Q1. Now, our 1-year-olds and 2-year-olds are actually pretty good compared to New South Wales. We're up. Our 5-year-olds are a bit dropped. Now, remember, our target's 95 for all of these. So 1-year-olds are actually tracking pretty good. We did get above the 95% mark for a little while. We've only slipped below it in the last few quarters. Our 2-year-olds, which are notoriously difficult to get up to date, are still 91.9, better than New South Wales, but still not fantastic. And our 5-year-olds, yeah, we need some work. Now, before we jump into the reports, again, there's lots of befores, isn't there? It's useful to understand when and where patients are getting their reminder letters. So we know that you guys send them out, which is excellent. but it's also kind of helpful to know what else they're getting. Now, in the beginning, the overdue notices were being sent by Centrelink, and that was only going to children who were receiving the family assistance payments. Now, this was linked to your no jab, no play, no pay, no everything else policy that was going at the time. But they realised that there was a whole bunch of children who were not receiving any reminders, because if they weren't on a family assistance payment, they didn't get a reminder. So they introduced, maybe late 2019, some more overdue letters, and these came out at a different schedule point. Now, these came from Medicare, and they went to children not receiving family assistance payments. In addition, they also added overdue letters for adolescents for those vaccines, and you can see that they are 14 and a half, 17, 18 years of age, and they came from Medicare. These letters instruct the patients to contact their general practitioner, that's you guys, to follow up for their vaccinations and make sure they get it within the funding window. Now, AIR reports. There are 3 main AIR reports that are accessible to practices. That's your 42A, which has had a bit of a facelift, and it can now allow you to look up who has had no COVID vaccines in the last 6 months. A really fabulous report for looking up for booster doses. You could use that one. The AIR 10A report, you've probably heard us trying to teach this one before. This is for accredited practices. It's kind of like the report you receive from us, except the children are included on that report because they've attended your practice for any NBS service item. That can be a sore toe, sore eye, or it could be a vaccination. So that's how they're included on your report. So it's probably more your active patients, because you can select an MBS service period to include. So I only want to look at patients who have been here in the last 12 months, for example. But you need to request that report yourself, download it, probably do a little bit of Excel work on it to get yourself a nice neat list at the end. Now, the 11B report is the report you would use if you are not accredited, and this is just by individual provider. But we thought we'd take the legwork out of it for you, take out some of the barriers that we heard that you were facing for time to download, time to manipulate it in Excel, all of that. And we now download what we call an AIR 11A report. This is accessible to PHNs, public health units, state, that type of thing. We collate that data and we generate a practice-specific report, which, as you know, includes children who are overdue for a vaccination and they last received a vaccination service at your practice. That's how they're on your report. So when we send these reports out every month, these are the most common responses that we receive from you guys back to us asking for assistance. First one, child's up to date. We gave those vaccines already. This is an easy one. We'll cover this in a minute. The next one is, my report is full of kids who we haven't seen in ages. I can't get hold of them. They've probably gone overseas. Please delete them from my report. We'll cover this one as well. We can't actually delete a child, so it's a process that you have to do, but we'll look at the steps. Next one, I looked them up in there and they're up to date. Why are they on my report? Please delete them from my report. Again, we can't, but we can help you make sure they're removed. The parent said that they vaccinated their child elsewhere recently. We've got a solution for that. They've moved to Dubbo. We've got a solution for that. We have never seen that child at this practice. We also have a solution for that. Now, we also, in every report that we send out every month, there is a link to what we call the Actions Overdue Guide. This is a really handy guide. It pretty much covers everything I'm talking today. And I would always suggest that you have it printed out on your desk whenever you're looking at your overdue reports, and it will tell you what to do with each type of situation. You, of course, can always ask us for assistance, but I bet you'll find the answer in here for most things. Okay, so what was that first one? This one we said was an easy one. We already vaccinated the child. Okay, that's excellent. If you have the information about that vaccine encounter in your practice software, it's not in AIR. That's why they're on that report. So you need to get that information into AIR. So it's probably a data transmission error. You can either resubmit the encounter to AIR via your practice software, or you can just log on to AIR online and directly enter the information into there. This is if you vaccinated the child at your practice. So that means you have evidence of the vaccine being given. Easy one to fix. The next one, the case of the disappearing child. So when we first started sending out reports, we had lots of practices calling us, arms up, going, no, we haven't seen that practice in ages, we've got no idea where they've gone. So we can actually process that through AIR to make sure that they're not on your reports anymore. Most likely the child hasn't been to the practice in a long time, and they're probably overdue for quite a few years, is what we find on the reports. So the first thing we need you to do is check notes in all of the family members for message about maybe they've moved overseas. Now, often you might have the mother, the father, the uncle, the sister, the brother, the grandmother, even one time was of assistance, depending on how the family unit is structured. It could be in the notes of one of those patients, but it might not be in the actual child. So have a bit of a look around. You need to be a bit of a sleuth and look for evidence of that. If you do find evidence that they've moved, you can go into AIR and tick the RMI box on the AIR website, and I'll show you how to do that in a moment. So that one is a, yep, we know they've moved overseas. Now, if you can't find any evidence of that, but you have tried all contact options for the patient, again, the mother, the brother, the sister, the uncle, the auntie, the grandma, if you have a mobile number, an email, an address, you could try all different contact numbers for those families. And remember, sometimes on the overdue reports, there's an email address, and that email address comes from Medicare. It could be different to the one you have. So try that one as well. Often we find if people have moved overseas, they keep their email, but not their mobile. So email is a good way to try to contact them. Now, if you haven't seen this patient for a while, and we're not talking a few months, we're talking, like 12 to 18 months kind of a while, and you've tried repeatedly to contact them through multiple contact methods, not just we phoned them on Friday and they didn't answer. And I would suggest that maybe this needs to occur across 2 months of reports, not just a one-off attempt. Then, if you cannot contact them and you've ticked all those boxes of I can't find them, they haven't been here in ages, we call that lost to follow-up. And it's the same process of ticking that RMI box in AIR. Now, the RMI box, the magical box that removes children from your list, it should only be used for the appropriate circumstances that we've just discussed. And what it does is it effectively puts the child's AIR record to sleep. It doesn't delete it, doesn't inactivate it. It's kind of in sleep mode. And what that means is the child will no longer receive any remaining overdue letters to be posted, because what you're saying is the child is not at this address anymore. They'll also be taken off your overdue list, because we don't include children that have a return mail indicator in the list. They will also be taken out of the coverage rates calculations for your area, which is quite important. As we found with the eastern suburbs, we have a huge transient population in Sydney. Eastern suburbs is one of the worst culprits for it. Everyone loves to come to Australia and move to Bondi for a year. They get their first child vaccinated and then they go back overseas. So the rates in the eastern suburbs are highly affected by the fact that there's so many kids who actually aren't here anymore. So you're helping us work out the more accurate coverage rates for the region, which also works out where funding goes. We don't want to be spending all this money funding eastern suburbs, for example, if we actually find out that their rates are really good. It's just that all the kids on the list aren't even here. So that's a really good one. But for you, they're off your list. Now, if the child comes back to Australia, or, I don't know, maybe they went bush during COVID. So if they pop up behind a rock and suddenly arrive back again, as soon as they attend any medical service for an MBS service item in Australia, this box will automatically be unticked. So you don't have to worry that you've put their AIR records to sleep permanently. If they do pop up or they do come back, this will be reactivated. You don't have to go and do it. It happens automatically as soon as Medicare is kind of touched by them. Right, the next one. But they are up to date when I look them up in AIR. So I've got a question. This is becoming the most common question that comes through from practices. Did you look the child up through your practice software? Or did you log into AIR via Proda on the website? The reason I ask is it makes quite a difference to what you've actually found. If you did it via the practice software route, that means you looked up the child in your practice software, clicked on the View in AIR button, and you saw their AIR records, and it said that they're up to date. So you went, no, it's all good, they're up to date. But what you've actually likely discovered is a duplicate. If you looked up a child directly in AIR via Proda with the information that was in the overdue report, so that means you log into Proda, you go through HPOS into AIR, you use the information that's actually on the report, not the information you got in the practice software, and you look up the records, you'll find that there is an overdue record for that child, but there's probably a slight difference. And what you'll find the most common difference is that one record has a Medicare number and one doesn't. One has a slightly different spelling of the name. So let's say children with a double-barreled name, first name, that is. So I don't know, let's use Billy Ray Cyrus. So you might find that there's a record for Billy Cyrus and a record for Billy Ray Cyrus. And that has then created a duplicate. And when you're looking it up through your practice software, it's connecting to the record that's actually up to date. But there's another record for that same child, slightly different, that isn't up to date. And what you found is a duplicate, and you need to notify AIR of that duplicate so they can merge the records. And then they won't be on your overdue list anymore. So what you do is email AIR to notify them of the duplicate and the records to be merged. It's really important you provide them with a lot of information of the two different records. So all of the information, so if there's a Medicare number, if there's a date of birth, the exact spelling of the name, the address on record number 1, and the same information for record number 2, and request they'll be merged. They're usually pretty quick at merging the records, but sometimes it might take a few weeks. So if they pop up on your next month's report, feel free to either email them again or just note it on your report. And if they pop up on the following month, I'd probably contact AIR and say, hey, I think you missed that email. How do I email AIR, you say? What we don't want is for you to email just from your everyday Hotmail with patient details. What you need to do to contact AIR via email is use their secure AIR email service. This is actually done through Proda, not through AIR. So you log into Proda, you click into HPOS, and you get this wonderful screen with the coloured tiles and a bunch of nurses. If you click on the messages tile, you'll be taken to your inbox. And what you'll find is a pile of messages that you didn't realise you had, probably. That's what we usually find. But when you select a new message, there's a drop-down list of recipients. So you can't use this Proda email to email anyone. It's to use to email these health services, and AIR is one of them. So you select AIR and then you type all your information in there. That way you know it is a secure system to be able to send it. And on that note, a lot of practices do email us for assistance with some of the patients on their reports because you're just using normal email. It's not as secure. So what we'd suggest is that you maybe just give us the initials of the child and the date of birth, because we have a copy of your report, so we can look at the report this side and work out which child you're talking about. Just better than writing all the details. Now, the other thing I mentioned in that previous example was that you could check a patient's records in AIR directly from your practice software. So just in case anyone hasn't done that or didn't know they could do that, you can. It's a new feature. It came in towards the end of 2022. So as long as you've got the most up-to-date software, you have the ability to do it. As a practice nurse, you would actually need to be set up slightly different in your practice software to enable you to access it rather than logging in a GP's login. So a medical director, it's called the AIR Auxiliary Provider Number, and you have to set it up through the user database. In best practice, it's called the Location AIR Provider Number, just to confuse you. But AIR themselves refer to it as an Organisation AIR Provider Number, and you can contact AIR to obtain that. It's quite easy to do, and you can contact us at the end if you need assistance with that, or you can also contact your practice software provider to assist you to set it up. And I've got 2 images there. So in the Premier, you can see there's a View in AIR button, and in Medical Director, it's called the AIR Patient Verification Check, because of course we don't like using the same term across different platforms, because that would be way too easy. Okay, some of the other examples that came up. We have never seen that patient here. I get this a few times. No, it's not a super common one, but it does happen. But invariably, you actually have seen the patient there. You just need to do a bit of digging. So the first thing I'd suggest is you check the report. So that's the overdue report. For the last column on the right, actually has a provider number. Now, the provider number that's listed there is the last provider of the vaccination service for the child. Now, that provider number, the details of that provider number in AIR indicate that it's from your practice. So that is either they put your practice name or your practice address into AIR when they're registered, and that's how we've linked them to you. And that's why that patient is on your report. The most common scenario that we find is that it is an old provider who's no longer there, and that patient is probably an inactive patient, so you might not even be able to look them up initially when you look. So I'd suggest you maybe take the provider number to your practice manager if you have one, and look up a list of past and present providers to see who this is. Another thing that you could have discovered is that it could be a duplicate again. So yes, they were seen by a provider there, but they're not in your system under the names that they are on the report. Again, so let's look them up using slightly different spelling, dropping off an additional name, look them up by their date of birth, by their Medicare number, address, whatever information you have to see if you've actually found a duplicate record. Now, 99% of the time, as I said, we find that the patient does belong to the practice. It was just a bit tricky to find. There is one scenario that I've come across where it didn't, but it belonged to the provider. And it was a scenario where a practice nurse worked at 2 different practices. And lo and behold, that provider also worked at 2 different practices. So when the nurse was entering some information into AIR on behalf of that provider, she selected the incorrect provider number for the provider. She selected his provider number from the other location. So the patient did see the provider, but not under that provider number location. So that's where it got a bit confusing. Unfortunately, you can't fix it in AIR once it's already registered that way, but at least it was the right provider, that they could chase that child up through the other practice. Now, some of the responses that you may hear from parents. Oh yeah, Johnny's up to date. We vaccinated him at practice ABC a few weeks ago. It's all good. Well, unfortunately, Johnny's records aren't up to date. So you can instruct that parent to contact that provider and ask them to update the child's record on AIR as soon as possible before they get an overdue letter. Or what about, oh yeah, we've moved to Dubbo. We did that a few months ago. Great, we can get them off your list, because remember, your list is location-based. So it's only children living in CESPHN. But they obviously haven't updated their address with Medicare. Medicare and AIR sync every 24 hours. So the address in Medicare is still Sydney. So you need to instruct the patient to change their address in Medicare. It obviously gives them a courtesy reminder to get vaccinated in Dubbo. So let's have a look at a report. We've gone through most of the scenarios, but sometimes it takes a little bit of kind of sleuthing to know what you're looking at when you get a report. Now, this is an example of a report. Unfortunately, every child has the same surname starting with A. I've de-identified everything, but I've stuck some blue lines in there so that you can see the difference between each child in the report. So there's 4 on this report. Now, as I said, we send these every month to practices. So this is what they'd look like. Now, the first thing that stands out to me when I look at this report is child number 1 is now almost 4 years overdue for one of the schedule points of their vaccines. And that schedule point were their 6-week-old vaccines. That's a massive red flag. They're overdue for their first vaccines. The next red flag is that there's no Medicare number. So no Medicare number combined with 4 years overdue from their first vaccine is either they've left the country just after they were born. It's probably unlikely that someone would skip countries within 4 or 5 weeks of birth. It does happen, but unlikely. The next idea is that this is probably a duplicate. So this maybe is the record that was created at birth when they had the Hep B dose, and it was before the child had a Medicare number. By the time they've rocked up for their 6-week-old vaccines to the practice, they have a Medicare number. They might have slightly changed their name as well, because sometimes we do that. We've just given birth and we give them a name and then we go, no, we want Billy Ray instead of just Billy. So they might be slightly different there as well. There's also the scenario where if a child has not had a name allocated to them yet, in the system, when they have that birth dose, it will be entered as baby of and then the mother's maiden name, just to really confuse things. And then when they have a Medicare number created for them, once a Medicare number is created, an AIR record is automatically created for a child. And if for some reason those 2 AIR records don't sync, you'll end up with a duplicate. Now, there's probably one record carrying along happily all up to date for this child, but this one's sitting here unfilled, and that's a duplicate. What you can do is look up your practice software to see if you can work out who this child is. So using the name, date of birth, the address, that kind of thing. You can also search in AIR for another AIR record for the child and check out what the spelling in that is. And this is when you notify to AIR as a duplicate so they can merge it. The other one that stands out really quickly on this report is child number 3. So it's pretty unusual to see a single antigen missing on a 4-year-old dose. So unless they somehow went overseas and got a vaccine that was all split up into bits and they didn't have polio, again, probably unlikely, this is probably just a data error. So you can either log into AIR and fix it up or contact AIR and ask them to fix it up if you were the one who vaccinated. If you weren't the one who vaccinated at this 4-year-old dose, when you contact the patient, ask who was and get them to fix it up. Okay, so how can you keep your overdue list small? It's good to know that children are actually flagged as overdue by AIR 1 month after their due date. So if they're due on the 1st of September, they're not overdue until the 1st of October. So if you can catch them in that window, you'll save them getting an overdue letter about their family assistance payments. You will also save them coming up on your list. Ensure your practice has an active recall and reminder system in place, and it's one that's actually used. So I do hear of nurses working really hard to make sure these reminders are in there, or recalls, whichever system that you're using, but nobody acknowledges the prompts. They all just go, yep, 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 and click through the prompts. And many times we've worked with practices and the nurses are looking up the patients only to find, oh, that guy was here, you know, a month ago or a week ago. They weren't there for something with a high fever or anything like that that might interfere with getting a vaccine. They were there for a sore toe, a great opportunity to vaccinate, and they didn't use that opportunity. And there's no notes in the patient note to say it was discussed and booked for another time. It just was forgotten. So it's really important, if you're finding that that's an issue at a practice, maybe a chat with the practice manager to see if it can come up at the general meeting about how we can follow up our overdue kids. If you don't already have a phone call in your recall and reminder system process, maybe add it in. Don't just rely on SMS. SMS is great, but after 2 SMSs, a phone call might be a better option, especially if you've got a vaccine hesitant parent on the other end. And an SMS just doesn't give them that opportunity to ask questions. And they're probably less likely to call to ask those questions. But if you've called them, there's an opportunity to engage. And don't forget to be ready to discuss the vaccine hesitancy. And you can do that by reviewing some of the Sky resources for providers. There is an online e-module for that as well that you can do. So another great CPD opportunity. So if you have a look at this actions provider list, actions for providers, list, and have it printed out on your desktop, I can guarantee you your practice overdue report will look shorter next month. So please print it out. It is linked to every practice report that we send you. Why not make your practice report efforts a PIP QR project? So you can do that by using some of the templates we've got. This template is for use of a 10A report. That's that one that we spoke about earlier. But all you do is change the wording for what you're going to do. You could get your August report and pick 10 patients at random on your report and follow them up for the next 2 months. And you would either catch them up, mark them as out of the country or lost to follow-up, or fix up the data, the 3 main things that can happen with the child, and you can clear them off your list. If you need any help with QI stuff, again, feel free to contact us. Now, what are we going to do with these reports in the future? So we've streamlined it and we're up to 300 practices. Our aim is to spread it out wide to all of our practices. I think we have a bit over 500 practices now, so we should be able to do that. But what you're going to find in your inboxes in the next 2 months is a report to assist you to follow up Zostavax. So as you may or may not be aware, the funding for catch-up of Zostavax for 71 to 79-year-olds is about to run up from the 31st of October. So that means you've only got until the end of October to catch up anyone aged 71 to 79 years for the Zostavax vaccine. After the 31st of October, they don't qualify for any funded vaccine for shingles. They would have to pay. So it's a really good opportunity to chase them up now. For your 70-year-olds, they currently qualify for a Zostavax vaccine until the 31st of August. But from the 1st of November, they can get Shingrix, which seems to be a much better vaccine. So if you've got someone who's 70 who will still be 70 on the 1st of November, you can discuss with them the options about whether they want Zostavax now or wait for Shingrix. But if they're going to be 71 on the 1st of November, get them a Zostavax now. Otherwise, they will miss out and they will have to pay. So we're going to give you a report identifying those patients on the first week of September, and then we'll give you another one on the first week of October in the hope that we can catch as many of the age group and get Zostavax by then. We also hope to, further down the track, maybe apply these reports to help you chase your 70-year-old plus for pneumococcal. And what about chasing HIV for our overdue adolescents as well? So they may have missed their school vaccines during COVID when everything was a bit disrupted. So that's a chance to catch them up as well. Lots of useful contacts for you. As we said, do not just go emailing air from a normal Gmail or Hotmail or whatever it is. Try to use a secure email, which is via Proda. You can also call them on those numbers for help, depending on which category you're in. Our email is there. Plus, you can also always respond to the email that the report is sent from. And the person on the other end of that will be able to help you. We also have a phone number, of course, and we also have our website with heaps of information. And now, time for questions, if anyone has any questions. I think one of our team is going to assist us by calling out any questions if there is any.
Yes. Hi everyone, it's Kira. So Brooke, our first question was covered within the seminar, but I guess just to go over it again, how can we cancel the name on the list if they don't want to come back? And that would be come back for a vaccine, hence vaccine hesitant, or if they did it somewhere else.
Okay. So if it's vaccine hesitant, I would obviously have that conversation with them about why they're vaccine hesitant, what their queries are, also letting them know what the side effects, for lack of a better word, is of the child not being vaccinated. Some parents aren't aware that it may impact their ability for family assistance payments. They might be unaware that it might affect their ability to enroll their child into daycare or preschool, because you actually cannot enroll a new child if they're not up to date. It may also affect some other things that they're wanting to do as well. So letting them know that that could potentially be an issue for them is quite important. And then addressing why they're vaccine hesitant. A lot of times they have some questions, so prep yourself with that SCI information. If necessary, it might be a question that they will feel more comfortable talking to a GP with, so you could also flag that. Now, if they still remain resistant and don't want to vaccinate, you can't actually remove them from a list. You can't have a conscientious objector anymore. That's not a thing. So they'll just be on your list each month. So I'd maybe suggest that every now and then you touch base with them just to see if they've got any new questions. But otherwise, there's not much you can do once they fully refuse. Now, the second part of the question, you said that they might have indicated they got vaccinated elsewhere. According to AIR, they haven't. So if they did go elsewhere, they need to contact that provider and get those records uploaded to AIR because they're not in here. Next question.
Thanks, Brooke. We've only got one other question so far. Zostavax is under restriction on supply. We can only order 5 doses per practice. You know, if you need to recall the people, they might not be able to accommodate their needs. Could you advise on this matter?
Okay, for that one, I would suggest you contact the State Vaccine Centre. Maybe get the report that we're sending you. Do the investigations. We're going to give some information in the email that we send the report about truly identifying if there's 10 people on your report who is truly overdue for a shingles vaccine. And then I'd contact the State Vaccine Centre and say, we have 8 patients, for example. We'd like to get them vaccinated within the next month. What can we do? And they might have a special release for that. I can't promise anything. But if you go to them with a defined number of patients that require the vaccine, you might have a little bit more help other than just saying, give us some more vaccine.
Great. That's all for the moment.
Excellent. Well, we're dead on time. So we'll wrap it up with that. There is an online evaluation form that will come up at the end. Our friendly CPD team will also be emailing you a resource which has lots of contacts and information about what we've discussed today. And the webinar is also recorded. So keep an eye out for the Sydney Health Weekly and the immunisation newsletter that's embedded within that. And once the webinar recording is available, it will be available for you to watch and share to your heart's content. If you do need to record CPD points for this, if you're a GP, you can do a self-reporting to the RSCGP for this on the dashboard. Other than that, thank you very much for attending. We hope it was of assistance and look out for your next overdue report.